This is a community analysis of South Tampa by Scott Fast of St. Petersburg College. This presentation will look at South Tampa's history, overall structure, population, health resources, environment, government and public policy, and conclude with 6 prioritized areas of concern that need to be addressed as a result of this analysis. The first Spanish explorers arrived in 1528. The area became known as Tampa, which means stick of fire. In 1884, H.B. Plant made Tampa the railhead of the South, which stabilized the area. In 1885, cigars became the city's chief industry. In 1886, O.H. Platt purchased a parcel known today as Hyde Park. Platt and Plant reshaped and revitalized South Tampa to attract affluent citizens. Early 1900s, the citrus industry moved into the area. Until the 1940s, shipping and the docks thrived during wartime, but the 50s and 60s saw relocation into the suburbs. The 70s pumped new life into South Tampa when it was recognized as a historical district. South Tampa is represented as District 4 by the Tampa City Council. Today, South Tampa is one of the most sought-after neighborhoods in Tampa. South Tampa's architecture, food, and traditions remain heavily influenced by its Spanish past. Cigars remain a key export with a renowned reputation for excellence. The annual Gasparilla Festival is a local custom that celebrates the Spanish invasion of the area. Annually, over 500,000 people attend this one-day event held in the streets of Tampa. Overall structure of South Tampa. Tampa's 3.7% unemployment rate is the same as Florida's state average and better than the national unemployment rate of 4.1%. 30% of Tampa's residents are living below the poverty line, which is above the state's 23.3% average and far worse than the nation's 12.7% of Americans living in poverty. South Tampa has a wide array of dwelling units consisting of multi-million-dollar mansions, bungalows, ranches, condominiums, and rentals. Tampa Housing Authority oversees subsidies and provisions assisting homeless, low-income earners, and veterans with housing solutions. The City of Tampa funds shelters, charities, and emergency grants for transitional housing, safe havens, emergency shelter, and rehousing assistance. 2 activity centers in South Tampa focus on providing free meal programs and transportation services to those who qualify. Hillsborough County funds various forms of transportation assistance for the elderly, disabled, and needy for a nominal fee. Metropolitan Ministries is able to assist adults and children in need of meals, supplies, medications, and transportation. This district supports multiple parks, 3 libraries, and a total of 16 public schools. There seems to be a great social economic disparity in this area. There's ample resources and social outreach programs, but surveying the area reveals an issue with homelessness. Population, South Tampa. Analyzing the population in South Tampa and Hillsborough County, Tampa is only 27% of the county's population. In terms of density, though, Tampa is over 2.5 times more dense than Hillsborough County. 88% of the population is made up of black and white people. 77% of the population is 18 years old or more. The gender ratio is 49% male and 51% female. The local rate of unoccupied homes is 12.2%, which is equal to the national housing rates of vacancy for the 4th quarter of 2017. It is estimated that over 500,000 people in the United States go homeless on a given night. At least 1,549 individuals go homeless on any given night in Tampa-Hillsborough County. But who are the homeless? What is the makeup of the homeless? They are a cross-section of the area. 40% are female, 20% are under the age of 18, 17% are Hispanic, 11% have served in the U.S. military, and 40% have some sort of disability, either mental, physical, or developmental. The Tampa-Hillsborough County air quality ranks last in the entire state of Florida. This is a manifestation and byproduct of many factors. The increasing population correlates with increased vehicle and manufacturing emissions. Nearby manufacturing plants' pollutants also include sulfur dioxide. During the dry season, these factors exacerbate the ozone pollution ratings because Tampa lacks a strong sea breeze. The link between Hillsborough County's top 4 diseases exists with their potential to be sexually transmitted. The 5th ranked disease, tuberculosis, has a higher correlation among the homeless than the general public. At-risk populations like the homeless are at an increased risk of getting TB because of the prevalence of substance abuse, HIV, use of crowded shelters, and a delay in early medical care to detect and diagnose TB. South Tampa is home to 4 acute care facilities that vary in function, capacity, and services rendered. Kindred has 2 facilities offering select specialty services but no emergent care. Memorial, a for-profit hospital, provides emergency services. Cases that are beyond their scope are transferred to Tampa General. Serving as Central Florida's Level 1 Trauma Center, Tampa General is a teaching not-for-profit hospital. Tampa General is the area's full-service provider of healthcare needs for adults and pediatrics. The Tampa area has 19 long-term facilities that offer varying services and amenities. The price is a median daily cost of $275.75. Specialty programs are offered to meet the needs of patients. 24-hour nursing coverage is available at 12 of the facilities, and 8 are nonprofit organizations. Forms of payment accepted are Medicare, Medicaid, insurance, HMOs, and workmen's compensation. There are 10 acute living facilities in the South Tampa market. The median cost for a single occupancy apartment is $2,750 per month. This cost includes rent, utilities, dining, housekeeping, and transportation. There are 95 home health agencies in the Tampa area, and 9 of these are not-for-profit organizations. A customized service centered around skilled versus non-skilled needs will drive appropriateness of an agency. Not all agencies are Medicare or Medicaid certified. Local Memorial Hospital serves as the treatment facility for mental illness, psychiatric disorders, and substance abuse. Open 24 hours a day and 7 days a week, intervention is available for adults and children. Forms of payment are Medicare, Medicaid, and self-pay. Tampa currently has 45 urgent care centers, with 66% of the clinics open 7 days a week and 6% specializing in pediatric care. The abundance of available health resources places Tampa in a unique position of accessibility to industry-leading treatment options. In this section, 3 objectives have been chosen for South Tampa using the Healthy People 2020 guidelines. Substance Abuse SA4 objective is to increase the proportion of adolescents who perceive great risk associated with substance abuse. Millions of Americans struggle with drug or alcohol problems, and South Tampa is no different. Substance abuse has a rippling effect on individuals, families, and communities. Substance abuse often has a significant role in disease process, teen pregnancy, motor vehicle accident, or poor decisions resulting in tragedy. Environmental health EH3. The goal is to reduce toxic air emissions to decrease the risk of adverse health effects caused by mobile, area, and major sources of airborne toxins. Our own interaction with the environment has a direct correlation on one's quality of life, years of life, and disparities in health. The air quality in Tampa is the worst in the state of Florida. Poor air quality is linked to premature death, cancer, and long-term damage to respiratory and cardiovascular systems. Physical activity PA2. The objective here is to increase the proportion of adults who meet federal physical activity guidelines for aerobic physical activity and for muscle strengthening activity, ultimately improving health, fitness, and quality of life through increased physical activity. Regular physical activity can lower the risk of coronary heart disease, stroke, cancer, blood pressure, obesity, diabetes, and improve cognitive skills. South Tampa is home to over 30 parks. The major parks along the waterways are Bayshore Linear Park, Ballast Point, and Picnic Island. The 4.5-mile long stretch of continuous walkway along Bayshore is the longest in the world. This area is the crown jewel of South Tampa, exuding a vibrant energy and wellness. Ballast Point offers play areas for children and a fishing pier. Anderson Park has some basketball courts and is pet-friendly. Bobby Hicks Park maintains a popular pool and recreation center. Picnic Island offers a tranquil, sandy beach experience with open areas for grilling, picnicking, frisbee golf, and a play area for children. South Tampa lies in District 1 of the Patrol Division. Crimes reported for the Tampa area totaled 10,207, of which 1,921 were of a violent nature and 8,286 were property related. A Tampa resident has a 1 in 196 chance of being a victim of a violent crime and a 1 in a 46 chance of being a victim of property crime. Tampa's crime index of 22 means we are only safer than 22% of the U.S. cities. District 1 is served by fire stations 14, 15, 17, and 19. Tampa Fire Rescue's compliance benchmark is to arrive at the scene within 8 minutes of the initial 911 call, 90% of the time. South Tampa's fire department exceeded this benchmark by arriving to the scene within 8 minutes, 96% of the time. The two major providers of EMS services are AMR and AmeriCare. Combining AMR and AmeriCare's expertise in life supporting transfers, BLS transportations, and expertise in disaster preparedness provides the South Tampa area additional coverage and confident ancillary support in the time of need. Tampa's water supply for drinking has met the standard without violation. Flooding is a South Tampa problem that has been ongoing for years. Flooding does occur even without torrential downpours. Household waste is disposed of twice a week and recycling programs are in use. Abundant parks, beaches, piers, abutting nightlife, and responsive public services make South Tampa the place to be. There are several alarming issues concerning South Tampa's environment, though. Tampa has the distinction of being the second deadliest area to walk in America. Several reasons exist, and much of what makes South Tampa great are the exact ingredients for this perfect storm. The area is beautiful with throngs of people running, jogging, and biking. Coupled with excessive speeds, high traffic volume, which may be taken in the sights too, and sprinkle in poor signage, narrow walkways, and confusing sidewalks, we then get the perfect recipe for some of the deadliest roads in America. It is also disturbing to know that our community is only safer than 22% of the cities in America. Factors in play here include large socioeconomic disparities, substance abuse, large transient population, and homelessness. It is imperative city leaders acknowledge and act accordingly to preserve the safety of this community. Government. City of Tampa government consists of Bob Buckhorn as mayor and city council. There are 7 council members. District 4, which is South Tampa, is represented by Harry Cohen. There is also advisory boards and commissions, which play an essential role in promotion of good government and effective and efficient delivery of services. The terms for city council and mayor are 4 years. Council meetings are open to the public and held on the first and third Thursdays of each month at 9 a.m. Meetings can be viewed on City Tampa Television, which is channel 615 on Bright House. Agendas are available to the public in the office of the clerk or online. Many concerns over the city's deferred loans from the mid-90s exist and are nearing time for repayment. The budget was raised for the fiscal year 2018, requiring an increase in taxes. The new budget was increased to $974.2 million. 26.2% of the entire budget is committed to public safety. This $255.3 million is subdivided with the police force allotted $156.4 million, which is 61.2% of that allotment. And the fire department's $87.3 million is 34.1%. A 3% raise was negotiated with the union, which was allowed for additional hires for the Tampa Police Department. Some expenditures are mystifying, like the $2 million allocated to a center in New Tampa for gymnastics. Community needs. The number one priority for South Tampa is the issue of substance abuse. This single behavior can infiltrate and dictate other actions, creating further adverse consequences. It is also one of the problems that can, to a degree, be combated without large budget allocations. The second priority, increased physical activity, is also an action we can all accomplish independently without large sums of governmental funding. Improving exercise habits has been linked to a better quality of life, length of life, and lessen the financial burden stressing individuals, families, and the healthcare system. These two priorities were prioritized as such based on the ability to be affected by change independently. The remaining 4 community needs are prioritized based on an investment versus reward ratio. Homelessness and crime can often be linked to the first priority, substance abuse. Homelessness can be the catalyst for crime based on an individual's need for self-preservation. The homeless are more likely to suffer from chronic medical conditions, complications related to homelessness like TB, and increased utilization rates and duration of medical services, which strains limited medical resources and inflates costs. A crime index of 22 is not acceptable. If Tampa plans to continue to entice others to relocate and prosper, then we must be safer than 22% of the United States. Tampa needs to find creative ways to fund more patrol officers or find a more efficient means of patrolling. Priority number 5, revamping the sidewalks and signage in some parts of South Tampa would be of assistance for everyone. South Tampa is not the second deadliest streets to walk in America without reason. We have a transient population, confusing walkways, and at times inadequate signage to assist anyone. The last priority, traffic, would require the largest governmental funding, investment of time, staging, and analysis to be done right. The traffic in South Tampa is a problem and a contributor to a host of other problems. The increased traffic causes increased risk-taking behaviors from the driver and pedestrians is a major contributor to our poor air quality. So the most extensive problem to resolve, traffic, is a factor in Tampa's deadly roads and the state's worst air quality index.